I am Dr. Grewal and welcome to BeepMD, where you have a front row seat to my drawing pad and how I explain medical conditions to patients so that it is easy to understand. So today we are going to talk about heart attack. We hear about heart attack quite a bit, but let's understand in a simpler way what it is. So here's my pad and I'm drawing a human body with a head and a chest. And this is our heart in the center of the chest. It is not really circular, but for convenience sake I made it that way. Before we even go into heart attack, let's understand what the heart does, because whenever a heart attack happens, the function of the heart is affected, and our heart does pump blood. So it basically gets all the blood which is depleted of oxygen and nutrients from rest of the body. Then it pumps it to the lungs, where more oxygen is assimilated into the blood, and now the blood has become oxygen rich. Then it is brought back to the heart and then pumped it out to rest of the body. This is how our heart moves the blood and then pushes nutrient and oxygen supply to rest of the body. So it's a very important function, and it does it about 60 to 100 times per minute. That's our heartbeat. So every single time your heart beats, all these four functions are happening. So these are arteries that I'm drawing here. We need to know that our heart needs blood supply too. Even though it's moving blood, it needs its own blood supply of fresh oxygenated blood so that it can work. And these arteries are known as coronary arteries. So what they do is they supply our heart with fresh oxygenated blood. And this is where the process of heart attack begins. So let's put in an arrow here. This is the yellow arrow that shows where I'm going to show you what's happening. So focus there. So what happens is, either due to stress, either due to uncontrolled diabetes, either due to genetic factors, either due to high blood pressure, or smoking, or drugs, or weight gain, obesity, things like that are cause of plaques to build inside our arteries. And as these plaques are building, they're basically blocking the lumen of our arteries, including these coronary arteries. And as the stressor gets worse and worse as we age, depending on how many risk factors we have, for example, people who smoke may have much faster development of these plaques. Eventually they become more extensive, and one day they completely block. And when they block, there is no blood going downstream, so the heart tissue downstream dies. And when that happens, this is what a heart attack is. Now this triggers a cascade of issues for our body, problems for our body. Number one, because now part of the heart muscle is dead, it's pumping less blood to the lungs. Eventually less fresh blood is coming into the heart, so it's pumping less oxygenated blood to rest of the body. So the whole body gets affected when the heart gets affected. And if the area of the heart muscle which is dead is very large, that can cause sudden cardiac death. People can suddenly drop dead because the heart is basically not able to supply enough blood to our body to keep it alive. So this is what we call as a heart attack. And it is important to understand the symptoms of heart attack because that's how we recognize a heart attack may be happening. So the first symptom is chest pain, which is the main symptom. May not always happen because people can have silent heart attacks, but chest pain is the most common symptom of a heart attack. The other symptoms are breathing, especially worse breathing on exertion. So many times, few days or few weeks before a heart attack happens, people may feel that they're having some trouble breathing on exertion, or they are having chest pain on exertion. Now this chest pain could be pressure-like. Many of my patients do not consider pressure as pain, but we as doctors consider chest pressure as chest pain. So let's talk about treatment of heart attack. So there are two basic treatments of heart attack. Number one is what we call is a clot buster treatment. It is basically known as TPA. It has to be given within 12 hours of onset of heart attack or chest pain. So this is a drug that basically is injected into the vein and eventually finds its way to the clot and hopefully opens the clot. The other treatment that we have is a angiogram. In angiogram, a catheter is placed into the heart, as you see, and brought near to the clot, and then with a roto-rooter or with a stent, there is a opening made or a tunnel made into the clot, and this procedure is called angiogram or PCI. And once that is done, there is restoration of blood supply to the dead tissue, and when that happens, there's a lot of tissue that is kind of not really dead but stunned, and that recovers because blood supply is restored, and we are able to save that part of the muscle. Now there are inevitably some muscle tissue that is dead, so there's always a chance of damage even after intervention. So this is what is heart attack is. Once an angiogram is done, of course the catheter is then removed, but a heart attack can be very serious issue, and the biggest thing is to get to the emergency room as quickly as possible. Thank you for watching, and subscribe to our video now, because we will be sending out more videos directly from my drawing pad. Thank you.